Our Prime Minister, for example, included daily exercise as one of the 4 reasons you could go outside and leave your home, right up there with needing to seek medical attention or help, getting your food shopping. And you know, that really did help. But what it didn't stop was a massive disruption to activity levels. And if we can have the next slide. Data has, with ComsRes and Sport England, we've been collecting data and releasing it right throughout the pandemic. Initially week by week, and now roughly every month. And there's another set of data coming out very, very soon. This slide shows the activity levels by gender, so male and females. And if you cast your mind back to the slides I just showed you, you'll see there's been a massive drop in the number of active people. And what you can also see as you kind of get to around wave 7, wave 8, if you can see that detail on the slide, as lockdown eased, as the messages got more complex, as there were more calls on our time, activity levels dropped. People's resilience to keep active also waned, and currently activity levels are at their lowest point. If we can have the next slide. So we've seen massive disruption, and that's going to continue. You know, the changes this week alone suggest we could be in some sort of restrictions for at least another 6 months. So I guess it is that we're at the start of this journey to recovery, to rebuilding our nation. Important to highlight that children have been disproportionately impacted by COVID in terms of their activity levels. It's just about 20% of children who are now meeting the CMO guidelines. And remember, pre-COVID, we were approaching 50% of children who were meeting that gold standard. And those who were already struggling, women, some BAME groups, older people, people with disabilities or long-term health conditions, they've seen the barriers they face increase and increase disproportionately. If we can have the next slide, please. But we are beginning to understand what the most important barriers are. And these are the 3 biggest: anxiety, the financial pressure some people are feeling, less disposable income, you know, just can't keep up the gym fees or pay for children to go to five-a-side once a week, and also the increased burden of care many people have faced. Whatever your role in the sport and physical activity or health sector, can you keep these things in your mind? We're trying to address and help alleviate these in everything which we are doing going forward. Next slide, please. So, what did we do at Sport England in response to that massive disruption, that almost chaos and change to the way we live? Well, first, we reorganized around these 4 simple priorities. Everything, we stopped doing lots of things, focused on these 4 things. And I'm sure many of you in your organizations have had to do similar things. Next slide, please. What we did very early on was pull together and create a 210 million package of help that's being shared out across England, and it's definitely helping. But you know, and I say this really soberly and humbly, I readily recognise that we haven't been able to help everybody. That 210 million's got to go an incredibly long way. We're still trying to secure from government support for leisure centres and leisure trusts. The fact, and I know this is an issue in your area, that some have folded, that's a massive blow. We can't underestimate the impact that will have. And I hope that we will have some good news on authority leisure centres and trusts soon. lots of the funding, for example, the Community Emergency Fund, has come direct and straight from Sport England. It's been our busiest fund. We received over 11,000 applications and we made 7,500 awards. Any bid which was fundable was funded. And over 200 clubs and groups across active Sussex's area have benefited from the fund, and awards in your area have totaled almost £750,000. Just give you a few examples. Hillcrest Amateur Boxing Club received 5,000. 10K went to the Eastbourne Bowling and Bowling Club, and Worthing Club, which I think is rugby and football, got 7K, and we've awarded 28 million in total through the emergency fund. But lots of the support, for example, the 20 million Tackling Inequalities Fund has been deployed through trusted local partners like Active Sussex. So you might not have realised that was support from us, and do you know, it really doesn't matter. The more important thing is that we get help, we get support out there where it's needed. Active Sussex's share of the Tackling Inequalities Fund so far is 220k. Half of that money has already gone out the door to groups working with the less affluent, BAME groups, disabled people, those with long-term health conditions. And we created the Tackling Inequalities Fund because we knew some of the very important groups which we really desperately wanted to help don't apply to open funding. They need the help of trusted partners. We've also rolled over funding for over 120 partners, including Active Sussex, to give them stability right up to March 2022. Hopefully that's helping. And to everybody in receipt of our funding, we've relaxed and increased flexibilities on what you can use our money for. And it's all about just keeping things going, keeping activity going where you can. And there will be further support coming in the not too distant future, probably three weeks, around the Sector Renewal Fund. And of course, we'll have to take into account the latest changes announced on Tuesday. Can I have the next slide, please? Our support, though, has been much more than just about funding. We've been helping DCMS draw up its guidance to the sector, bringing it together in one place, trying to make it as plain English as possible. We're working closely with local authorities to advocate for sport and activity to be part of the solution, even where local lockdowns exist. We've used our existing campaigns, We Are Undefeatable and This Girl Can, to encourage people to keep active. This Girl Can has actually gone live again just this week with a new advert, and I know many of you and indeed Active Sussex are doing great work to amplify that campaign, and We Are Undefeatable locally. So thank you so much for that. Within days, we also created and launched an entirely new campaign, Join the Movement, which was on TV, was on radio during the lockdown period, linked to an online catalogue of simple things you could do in your own home, or in that hour or so you were allowed to go outside to exercise. Can we have the next slide? So hopefully all of that has helped. What I think has also been helping in the areas which have them is our local delivery pilots. And Sadie particularly asked me to say a little bit about the pilots and particularly what we're beginning to learn. And I have to start with a spoiler alert. If you're expecting me to now talk about some wonder interventions, which are going to be rolled out in every village, town, city, area of the country, that's not what I'm about to share with you. It's something a little bit more different than that. Instead, what we've been doing is learning about the ingredients needed to drive whole system change. And that's not to say that lots of other people outside of these local pilots in your area, I'm sure this is the case, are doing things similar, and that's great. A reminder that there are 12 pilots. They cover from right at the top of the country down to Exeter. And a reminder of why we've got the pilots. It's about that population challenge, but with no blueprint to change at scale. It's also about trying to turn the telescope around, away from just focusing on individual barriers in isolation, to all the things which can influence us, the whole system, getting all of the arrows, instead of kind of pointing and working against each other, looking or working roughly in the same direction. And it's also really important to say the pilots started with no preconceptions of what was needed. They have truly been built bottom up by their communities and needs led. And the conversations have never started with money. And actually money has been important, but it's been less of the less of the debate and journey. You can have the next slide. What this slide does is set out the emerging ingredients which help drive whole sector systems. I'll give you a moment or two just to read them. And for me, this is all about people. It's about relationships between them. And it's about the better connections they can build. It's all about changing and seeding where power rests and building trust. Really, really deep trust across different levels and layers of our society. So to give you an example, Calderdale, one of the things they've been focusing on is seeking to transform their social care pathways. And it's all started with their director of adult social care, Ian Baines, freeing up his team, giving them permission to do things differently, ceding his power to them. What they were allowed to do was imagine doing things differently, think outside of the box. And the team started by really listening and talking, engaging, being challenged by older people themselves. They talked about wanting to move, but being so fearful of the consequences, what might happen if they fall, or what might happen to their benefits. And in fact, it was just about talking about lots and lots of things and getting to understand each other. What resulted, and this is cutting a long story, a long journey short, is that physical activity now forms part of every assessment a social worker carries out. It's challenged their stereotypes of what older people want and can do. And it hasn't cost loads of money. It actually hasn't increased the cost of social care. Rather, it's just changed how things happen. And that makes it really, really sustainable. And so there you see, no wonder intervention. Rather, the pilots are finding lots and lots of small interventions and changes, small changes with massive impact, because the systems we all live in and interact in become fitter for purpose and we don't rub against them so much. I've truly simplified that example and indeed condensed the learnings because of the time constraints this morning. There's a great 6-minute video from Ian on YouTube. Also on our website, there's an hour-plus webinar telling the story of social care and the changes Calderdale have made if you want to go and see the full story. You can have the next slide, please. So we're openly sharing what our learning is and drawing in learning. Anthony, could we have the next slide? I think we've probably jumped ahead, sorry. I should have been more patient. It should be the slide on how learning is being shared. So we're openly sharing that learning. We're drawing in learning from lots of other people outside of the pilots. Just about every active partnership is part of the community of learning, and all are welcome to join up to the community of learning. Via our local delivery section on our website. You'll find lots of other great resources, like the stories of each of the 12 LDPs. Pre-COVID, we were running face-to-face events, but as you would expect, they've all had to move online. Again, please do sign up for the next LDP webinar, and you can watch back all of the previous ones at your leisure. One which I would really recommend to you, the Local Voices package. It's not actually just focused on the pilots, it draws in lots and lots of other partners, and it's looking at what's been happening at a really macro, micro level during the pandemic. I think you will see there's lots of things which will resonate with what's been happening in your area. And the LGA Sport England leadership programme has also proved a really powerful way to share learning and best practice. We could have the next slide. So what I wanted to do in finishing off is focus down for a moment or two on the next phase of our strategy. And I want to say, actually at the outset, we're not creating this for, yes, we will have a 10-year vision, but we're also thinking about the here and now. What do we need for the next 6 months, the next year, the next 18 months, as we hopefully come out of the pandemic? As part of a whole year of discussion, debate, with help from many people and organisations, we've now distilled down into a much clearer format the direction of travel we're travelling in. And earlier this summer, we published a framework document setting out and testing the strategic direction. I hope many of you have had a chance to see that. I know it was also sent out ahead of today's conference. It's been viewed over 600,000 times, downloaded more than 3,000, and we've received hundreds and hundreds of comments, and there's still time to have your say. Our next strategy is built around that shared goal I talked about at the very start of my presentation. That belief that when we move, we are stronger. And that's true for us as individuals. It's true for us in our communities and wider society. And what our strategy sets out is that we care about new movement because of the benefits it brings. All activity benefits people's health, but when it's done in particular ways with other people, in groups, in nice outdoor environments, it adds much bigger benefits like mental health, the strengthening of our communities. And so we stand for everyone having an equal chance to live an active life and benefit from what that gives them. That's not the way the system works at the moment, so we have to stand together against the barriers to entry and progression. We have the next slide. And just like in the local delivery pilots, there is no silver bullet to that. No single policy partner program can make the change we need alone. Instead, what we're learning, partly from the pilots and partly from the work active partnerships do day in, day out, is that we need things to join up for individuals and communities if we are really to make a difference. We think at Sport England, we need to lead a movement to embed sport and physical activity into the strategies, policies, budgets, right across government, but right across England. And the emerging themes people have told us to focus on with our people, with our money, with our expertise, with our insight. They include, first, building back better. Now, I'm not sure that's the best term to use, but hopefully you get what I mean, and we can use that as a working title. We're all collectively part of a sport and activity ecosystem. If that disappears, it won't just be a blow. We'll never get it back or be able to replace it. So we must support the network of organizations who design and deliver opportunities to survive and thrive. In seeking first to survive and then return and thrive, we also know that we need to provide things differently. So it's not just building everything back, it's building back in a different, more inclusive way. The second theme is the foundations of an active society. It's about improving the experience of children and young people to shape their relationship with movement for life. Far too many of them get to adulthood thinking activity, thinking sport, thinking moving isn't for them. And we need a step change driven by building their confidence and their enjoyment. Those are the two biggest factors which help youngsters to achieve. Third theme is then connecting sport and physical activity better and even better with health, strengthening the links between health and sport and activity for mutual benefit. And we've got loads of learning coming from the current phase of our strategy. And then active environments. Much of our activity is directly triggered by the environments we live in. Driving a recognition of this and looking for ways to adapt environments and improve access for all is essential. Right from the start, over a year ago, when we started talking about our strategy, we said perhaps the biggest revolution would come in the way Sport England does things. And that's definitely been enforced and brought to life through the reactions to the framework. So central to working differently is truly embedding a focus on tackling inequalities in all we do. That's the single biggest message we've got from the consultation so far. Everyone needs something, but some people need more. So enabling work right across England, but getting support to the people and places where it is most needed, and holding fast to the principle of nothing about us without us. And that's about getting better and more varied voices around the table. We won't start with the solutions in mind, but rather highlight the issues and opportunities, and through inclusion and co-creation, develop the solutions with those closest to the issues. And of course, we've got to be brilliant at the basics, making processes easier, more accessible and simpler. We have the last slide, Anthony. We're now in the final stages of bringing our strategy work together. We're distilling it down even further from what we've heard, what we've learned, and we plan to publish the strategy at the start of 2021. We don't underestimate the scale of challenge for us and others to adapt and thrive in these challenging times. Everyone at Sport England is committed to listening and consulting and finding the solutions, and today is part of that process. I truly believe we do share a common purpose, that when we move, we are stronger. Now, more than ever, we need to work together in order for sport and physical activity to be part of our nation's future. Not for sport's sake, but because of the benefits it drives. Thank you very much. It's been a great pleasure to be with you, and I'm looking forward to taking some questions.
Thanks very much, Mike. That was fantastic, and thanks for opening our conference. So what I would invite people to do is in the chat box, or you can send them to myself directly. So in the chat box, just find Anthony Statham as a participant, and you can send them to me. We won't be able to do everyone's questions. We've got a few minutes that we can do, and we'll do which ones we can. I've had a couple sent to me already to start off with. So whilst you're having to think of your questions and where you want to go from there. So I've actually had one sent in from Sadie Mason. So Sadie, if you'd like to pop your video on and unmute yourself and ask your question. Thank you.
There we go. Right. Morning, Mike. Thank you very much for a very engaging presentation, very thought-provoking. I certainly like the common purpose. When we move more, we are stronger. So my question to you is around, let's have a look. So obviously we welcome the support that you've given us nationally and obviously in Active Sussex, and also the opportunity to feed into the strategy. So if Sport England had one key message or learning from what's happened in the last 6 months, what would that key message be for our sector leaders?
Gosh, that's that condense
Sorry,
it down. That, thanks, Sadie. That's that. There's so much in that. I think it is around tackling the anxiety issue and just being willing to be flexible. Can I answer it in terms of what I think needs to happen for our children, where we've seen the biggest drop and disruption. So that you could be in this time really purist about physical education or team sports and competition. Actually, the most important thing is that we just get our youngsters moving, and that we do that in a way that is enjoyable to them. So actually, if we have to put some of the PE curriculum to one side, or maybe we don't play team sports because they're really difficult, that's fine as long as we are. And so I guess it is about just combining effort to really ram home. If you're active and if you exercise, you may not push away the virus, but you will be able to deal with it a little bit better, and you might be able to just push it off a little bit further. And that's a great thing for you as an individual, but it's even more important for us as communities and as a nation. So right. Does that answer the question? I'm not sure it does.
Fine. I'm sure our Director of Public Health is listening in. So, yeah, that's great. Thank you.
Okay. Thank you, Sadie. So we've had a question coming from Sean O'Connor. So, Sean, if you would like to pop your video on or unmute yourself and ask your question, that'd be great.
Hi, Mike. Everyone hear me all right?
Yeah, I can hear you. Good morning, Sean.
Morning. So it's just a very, very quick one. Obviously, it was really interesting around the Community Emergency Fund, and I hadn't realised it was as much of that, which is great news. Just looking on the website now, and it says we're in the process of evaluating this fund, and all the updates in respect to its future will be posted here. Is it temporarily suspended at the moment then? And when does it look to reopen?
Yeah, so the emergency fund is paused at the moment. We're actually just the meeting I did before coming on this call was actually all about the evaluation of the fund. So we are nearly able to share that. There's some great news that we have been able to buy time for the clubs and groups we were able to help. It looks like we've brought time for about 9 to 12 months. That's all. And that was before any additional restrictions or local lockdowns. What I think is probably unlikely is that we will just reopen the emergency fund. What I think we will do is relaunch a much simpler, so building on all the things people liked. You only had to complete 4 or 5 questions. You didn't have to tell us loads of information. You didn't actually have to meet the governance code and things like that. All of that will get built into our small grants. around a theme of both continued emergency funding and a return to play. So covering the sorts of things which clubs are telling us they need. It costs more to put the signage in, to get the screens, to get the extra hygiene and things, those sorts of things. So that, I think, will be coming back. I don't want to give a deadline. I want to under-promise, but I think sometime in October. So please do keep checking back on our website.
That's great. Thank you.
Okay, thanks, Sean. I've got a question from Emma Greenoff around volunteering. So, Emma, I've only got a couple of questions, but if you want to ask one around volunteering, that would be much appreciated. Thank you.
Hi there, Mike. I'm Emma Greenoff from Brighton Hove City Council. I'm also the school games organiser there as well. It's just a question around volunteering outside of my work, actually, with netball. And it's just, I'm wondering if there's going to be further support from Sport England via NGBs to kind of reassure volunteers about making things COVID safe. We've had lots of conversations within our club about going back to training, and actually the netball league we play is actually being suspended at the moment. They were looking to restart, but it's been suspended again because it's all run by volunteers. And I think everyone's just worried. There's a lot of weight on people's shoulders about making things COVID safe. So just wondering what's going to happen, because that whole women's league, that's over 100 women now that won't be playing any netball between now and Christmas, which is really disappointing.
Well, great question, really important question. Thank you for what you're doing as the school games organizer. For your area, you repurposed what you were doing so quickly to try and help schools and parents at that time. So a massive thank you for that first. So the simple answer is it's absolutely on our radar, and I think there'll be some things coming fairly soon via Club Matters. And actually, it is again, anxiety, confidence has been one of the things we've talked about. We've actually seen lots of times the national governing body has said it's fine to do. Government has said it's fine to do. But the club or the volunteers just don't quite have that confidence. So we're looking at simple video messages and upskilling, which can just say, look, these are the things. These are the things. And actually, without oversimplifying it, the messages we keep hearing on our television about washing our hands, keeping a safe distance, wearing masks, all of those things actually are the biggest things which actually put security and allow activity back into that. But it's absolutely on our radar, and it's something we're talking with all the sports about as well. And I think also locally, it's something the Active Partnership Network can also help us with.
Thank you.
Thanks, Emma.
Thanks for the question, Emma. That's great. So I'm just going to go. I think it's Adrian. I think you've got a different name on your Zoom. I think I've got Adrian Gale on. I think it's more of a reflection than a question. But it'd be really great if you could share that, Adrian, if that's okay.
Yes, hello. To start off with, as everybody else, we're really pleased for the support you have put in place very, very quickly. And the support we get from Active Sussex has been really vital for us at a local level. And I think we ought to say that. Obviously, there's always things that can be done. I have particularly concerns the position of sport and physical activity in local authorities at the moment. And that's the future of people and places, especially due to the financial constraints and situations that a lot of us find ourselves in. Yeah. This will also affect how we on the ground can influence local strategies that we need to do in district councils and at a county level. How do you look to support local authorities as key partners? And secondly, do you have fears over facilities such as swimming pools, which are very costly to operate, closing, or at very least the updating of these facilities that might help with green issues and make them more viable, not going ahead and not being built? Thank you.
Yeah, thanks, Adrian. Really, really important points, and I very much recognise just how tough it is. I mean, it's tough wherever you are, but working in a local authority at this moment is not an easy job. So I think the first thing which we are doing at a national level is advocating for local government. We're working really closely with the local government association. We're regularly talking with the Ministry of Housing and Communities and Local Government. I think I got that in the right order. Advocating for the need and the important role which local authorities do. Then on a more practical level, one of the 4 key things every active partnership does in their primary role is supporting, connecting and helping local government. And that's why we've protected with rollover funding active partnerships. So there is definitely help there. In terms of the facilities, you can't but both swimming pools and leisure centres, you can't but be worried when you look at the statistics. I think the stats which I looked at a day or two ago from Swim England were that it's less than 50% of pools have reopened. It's slightly more leisure centres, but actually what they've been able to open with is much more modest because of the restrictions, but also what they can afford to put on. So it's absolutely on our radar. It's why virtually on a daily basis, my colleague Charles Johnson, who is our property director, is talking at the most senior level to the Treasury and to both DCMS and the Ministry of Housing, Communities and Local Government to nail the bailout we need for leisure centres and leisure trusts. We keep getting told it's winning favour, but the needs for me to be a greater sense of urgency, and of course recognising how tough it is for and central government money's got to go a long way. What we will be able to do at some point is bring back then the capital investment which we put into through the strategic facilities fund and things like that. I hope that will go some way. But yeah, the backlog of repairs, the backlog of upgrading, the backlog of creating the leisure centres we want, it's going to be a big issue, and I don't pretend to have all of the answers. We're in this together and it's on our radar.
Thanks very much.
Thanks, Adrian.
Thanks, Adrian, and thanks, Mike. It's actually coming up to 1:45, so we'll end the open questions there, so we can keep to time and go to our group discussions. There was some feedback in the chat around, there was some technical questions around return to play and bits like that, which I know are quite difficult to talk about in the sense that they're all individual. So I suppose what we can do with that is, again, follow up with either the national governing bodies or follow up with ourselves, or Mike, unless you've got anything you want
to
say.
So just really quickly on that one, we are regularly updating the COVID-19 Q&A on our website. Just go to our website, hit the virus section, and you will get that. So keep checking back. It would be really good, Anthony, if you could share that feedback with us, and we'll try and get, there'll be some things which are at such a level of detail we may not be able to help with, but where there are themes, we'll try and get additional Q&A up onto our website as quickly as possible to help with that.
Yeah. Okay. Thanks, Mike. And we can certainly share that afterwards. Okay. So What we're going to do now, so firstly, thank you, Mike, for your time this morning. It's very much appreciated, and certainly given us the context for not just the discussions, but the other sessions throughout the day. So thank you very much on behalf of Active Sussex and our partners for joining us. So in a moment, if the technology works, you will get a join button, and you will then go into a small group where a facilitator will be waiting for you. When that comes in, we'll have around 30 minutes in those small discussions. You'll then get a minute's notice and we'll come back in for the summary from the facilitators. So we are good to go. So you should receive a notice any moment. So just click on the join button and we'll speak to you soon. Thank you. Okay, we're just waiting for everyone to come back. It looks like everyone's coming back into the room now. So what we'll do is we'll go around the groups and just get three points, so the key points that you kind of talked about for everyone to listen to. So if we'll start with Sadie's group, if Sadie's back in the room. Sadie, are you able to give a quick summary as to what you're discussing in your group?
Yep, so we just had a quick rundown of the big issues that were highlighted in Shaping the Future framework. And for us, workforce and digital combined were some of the big issues in terms of upskilling coaches who previously might have been on furlough or haven't had direct contact, and they've had to do digital delivery and they've not had the confidence to do so. So not only have, the nature of their work has changed, there actually is a demand or a need for upskilling our coaches to be able to have the confidence to deliver online and also to understand the technology. So that was one great theme that came through there. We also had an issue, and it's a practical one in terms of capacity. So with children and young people coming back, and there's no after school clubs because some of the schools have to close at 3 o'clock for deep cleaning. So therefore, they're looking for those community outlets for the kids to go. The example was given in table tennis. They've seen a rapid rise in numbers of kids coming to their after school club and they can't cater for them because, there's no activity at their school. So capacity is an issue, definitely. And then we've got the opportunity, two opportunities really, in terms of making sure that physical activity and sport is really connected to the health network. So we talked about the emerging primary care networks and also a directive that has come from the NHS, which has a very strong focus on prevention rather than cure. And therefore, there's a big opportunity there for us to connect as a sector with the health sector and really demonstrate what our value is. And then the final thing is there's a huge appetite for the social side of the physical activity. So not just coming back and returning and playing, but actually connecting with our peers and friends. So it's that mental health issue as well. So those are the four key things that we spoke about. Thanks.
Thank you, Sadie. That's great. Well done, that group. We'll go to the next group for feedback. So we'll go to Henry.
Hello, everyone. Yeah, we had a good discussion in our group. Probably not so much about the Sporting England strategy because there was broad agreement with that, but I think, just about some of the challenges over the last 6 months and now over the next 6 months going forward. So there was a bit of a sort of frustration about how when you break down some of the barriers to physical activity recently, there's then the added barrier either of people being nervous about attending sessions in person, or some people don't like online activities when that's been necessary. So we had a bit of a discussion about that. And we've talked about one way of overcoming that, which Ricky with Sussex Bears and some of the other groups have moved activities outside that they wouldn't normally have outside. So Sussex Bears are doing their wheelchair basketball on floodlit multi-use games areas for the foreseeable. And I think it was Albion in the community's cancer sessions have also moved outside. And the participants who didn't expect to be doing it outside are now actually enjoying being outside and feeling a bit safer there. So that will continue till the end of October, assuming the rain doesn't get any worse. So it's no real conclusions, but just sort of considering these challenges everyone's got at the moment.
Yeah, that's great, Henry. Thanks very much for your feedback and for that group as well. Thank you for your discussions. So we'll go to the next group. So Gemma, have you got your reflections?
Hi there. Yeah. Again, we had some really fantastic discussions, and I think kind of in all the values that are coming through from the strategy framework were resonating across kind of the partners that were in our group. I think one of the key things that we discussed was around collaboration, and how, you know, we all talk about collaboration, but what does that actually look like? And ensuring kind of from that strategic point of view that we're thinking about the wider networks and the other sectors. So we talked about kind of the Arts Council and what their learnings have been and what support they might be able to provide to the workforce in terms of that kind of digital training. So, you know, what Sadie was saying around that kind of digital training for coaches, for instance. There are probably other organisations, networks that's what they do. You know, they can create videos. They know what to see. So, you know, it's about kind of joining up those connections rather than reinventing a new network or, you know, opportunity, actually connecting with them. One of the other things we talked about was in Sussex, we have got an ageing population, and therefore it seems like there's been a lot of support for older people. However, the working age, there was a bit of concern about what does the COVID impact in terms of financial impact, what's that going to have on that working population. We probably don't really know that, but for instance, individuals that might have been accessing the gym or sessions, if they haven't got a financial income, how are they going to keep active? And then we talked about kind of the local environment and how actually Sussex has got some amazing assets. You know, we're really lucky. We've got the coast, we've got the South Downs National Park, and we've got, you know, other green spaces. So what innovative ways can we use them? Can we think about, you know, working with planning departments to have temporary floodlights in those areas so that we can continue participating later on in the evening, instead of grants for specific sports equipment like footballs? Can it go to wet waterproof gear so that people can get outside, you know, even when the weather's not great? So about kind of just repurposing some of the funding or how we go about providing people with assets to go and do physical activity when we hit the kind of the darker and wetter months that are to come. And I think I'm just having a quick look. And then, yeah, workforce, again, just kind of picked up on that, and the diversity. And just thinking about it also is the parents and carers that are out there, they've also become a workforce, and they might have to become that workforce again when it comes to physical activity. So how are we continuing to support those? That was it from us. Thank you.
Thank you very much, Gemma, and that group as well. Sounds like there's some great discussions in there. So we'll go to the next group. So Andy, if you've just got like a couple of points, the key ones there, we'll go over to Andy Wright. Cheers, Andy.
Cool, thank you, Andy. Yeah, we had some really good discussions in our group too. A couple of bits that really resonated from the framework that Mike discussed. Rebecca mentioned that the putting aside the curriculum bit and how it's just really reiterating how important it is to think outside the box at the moment, to really reframe how we present sport. So that really resonated to her. And Amy mentioned how she really liked the partnership more important than ever bit that Mike said, and how we need to make sure we are looking at things differently. We are sharing our aims. We are being creative with the way we're working, the way we're supporting people to be active. So there are a couple of bits that really resonated. And then we looked at, so a couple of kind of bits that we need to have a bit more information on. So people wanted a bit more information about how COVID has really affected us in Sussex. We've had a big kind of national picture, but what are the real effects in Sussex? And can we share that better in terms of what the impacts are on the actual areas that have been affected beyond what we've given already? And also, we'd like a bit more clarification on targeting groups in schools. So the guidance is great that children in schools can be active, but it's almost too much and a little bit unclear. What they'd like is what are the most important things that they actually can do, just to make that bit of extra clarity. We had a good discussion around the tech sector as well, and how we can get the tech sector more involved, and how we can look wider into using technology well and technology firms. A couple of last bits. We really see this as an opportunity to actually plan now in advance. We know that we've got 6 months that we're going to be working in a COVID situation. So can we look to make sure that we are planning really well for that, and making sure we're getting those collaborative links going. And the last one was just around leaning on our medical practitioners a little bit more to get the message out a bit clearer. You must not be doing this. You can do these bits. We feel like we're preaching to the converted often. And actually, if we had a medical practitioner saying that you can't do this, it might have a slightly clearer message locally as well as from the national perspective. So our main bits.
That's great. Thank you very much, Andy. So we've got 4 more groups left, and we are starting to run out of time a little bit because we've got another session starting at 1:45. So if there's anything that sticks out that's very different to that, or if it's similar, if you can just look to capture those reflections now. So if we go over to Ross, Ross, have you got anything that's kind of echoes that or is different?
Yeah.
That'd be brilliant.
Yeah, I'll keep it quick then. So things we did mention was the reaction over the last 6 months by Sport England to what's going on, and the sort of flexibility and trust they've put in local areas has been great. We spoke about a concern around workforce and volunteers going forward, and around community clubs engaging with schools as well. A lot of that's been spoken about, but I won't go over it. One thing we did speak about at the end as well, which I thought was really, really important and sort of transcends all of what we're talking about, is around people's mental health and mental well-being as well at this time, and particularly over the next 6 months to come, when we move into those winter months, when we know that people's mental health drops anyway. But if there is less opportunity to be physically active outside and to meet in sort of, social groups and community groups and engage in that level of activity, then it's something we all need to be really aware of around mental health and mental well-being.
That's great. Thank you very much, Ross. Some good new points there as well. So thank you for that and that group. So again, Nick, have you got anything different or new? Or again, if it's similar, that'd be great. Over to Nick.
Yeah, so we had some really good discussions, quite similar. I think one of the key things we spoke about was it was reassuring from Sport England their approach to the last 6 months, and to hear them identifying the issue of anxiety from participants and people returning to activity, and how we can work together to ensure that those anxieties are put aside. And we also spoke about some of the issues with actually digital exclusion. We talk a lot about the digital world, but there are still some that don't have access to computers or the internet. So how can we work with those, or older age groups that might not feel confident? So how can we work collaboratively with them to tackle that? And then some more of the other things that have been mentioned, such as work in schools and trying to ensure that that's given a priority, but ultimately that comes from the government making schools prioritise it. A key part of the catch-up curriculum.
Brilliant. Thank you, Nick. And again, well done that group. So David, again, anything different to what's already been said?
A lot of what's already been said, really. We had a kind of a CYP focus in our group. We went through the big issues and we found that they're all really relevant if we are to try and put together a whole systems approach, and really to embed physical activity into everything we do. I also had Carrie in my group who was note-taking. So then if Carrie, did you want to add anything to that?
Yeah, sure. There was a lot of similar themes actually from what other people have said. So around like the anxiety and mental health side, the fact that Sussex has an older population, so automatically they're going to have lower levels of activity, maybe more long-term conditions, and maybe hit a bit harder by COVID, but also around the not having access to digital. So how can we reach those groups in a different way? And then a lot of worry around, as we had a CYP group largely, around opportunities for children, with the kind of lack of after school clubs, and very unclear mixed messaging around the return to play and things like that. But we also, as Sadie mentioned, spoke about the opportunity of like more synergy and working together with in terms of public health across the county.
Brilliant. Thanks, Carrie and David and that group. Again, some different things there as well, which was good to say about the return to play. So just to wrap up with the group that I was with, so the key themes that came through, we actually touched on a lot of the big issues just through our open discussion, which was interesting. So there was some issues around diminishing local resource and capacity. So how that might be impacting on various organisations throughout, whether that might be leisure trusts or whether that might be providers. There's, you know, some key issues regards to that. Workforce came up, people actually, volunteers or coach instructors, whether it's paid or unpaid, actually having the confidence to come back and feel comfortable within the environment, but also moving forwards, what sort of workforce we might need to get people active, those that are most in need. And then some more discussion around tackling inequalities and actually how sessions are more inclusive and where we go there. So they were the key themes that came through. So we'll wrap up the session there. Thanks very much for all your contributions within the groups and the questions after Mike's session. So Mike's not here now, but again, just a final thank you to Mike Diper for his keynote at the start. We'll send a follow-up in the next few days to get some feedback and any kind of documents, etc., or links that we might find useful from this session. So thank you very much, and we will see you all, some of you, in the next session starting at 11:15. Thank you very much.